1. When designing a client assessment for NCCPT certification, which principle ensures the most accurate baseline fitness data? A. Using a combination of subjective and objective measures. B. Relying solely on client self-reports. C. Performing only cardiovascular testing. D. Avoiding pre-assessment questionnaires. 2. In adult learning theory, why is experiential learning important for NCCPT candidates? A. It allows learners to connect theory to practical, real-world training scenarios. B. It focuses primarily on memorization. C. It discourages reflection on experiences. D. It limits critical thinking opportunities. 3. What is the most effective way for a certified trainer to assess progress in a long-term client program? Use ongoing performance-based assessments with data tracking. B. Conduct one final evaluation at the program's end. C. Compare client results with general population averages only. D. Focus solely on visual improvements. 4. Which communication strategy best supports motivational interviewing in client interactions? A. Asking open-ended questions that encourage client reflection. B. Using directive and closed questioning techniques. C. Interrupting clients to correct misconceptions. D. Focusing only on trainer-centered dialogue. 5. When developing an educational module for NCCPT trainees, which curriculum approach aligns best with adult learning principles? A. Problem-centered learning using real client case studies. B. Rote memorization of textbook content. C. Uniform teaching without contextual examples. D. Lecture-based delivery with limited interaction. 6. What is the primary purpose of formative evaluation in NCCPT training programs? A. To provide feedback during learning for performance improvement. B. To serve as a final grading tool. C. To replace summative assessments. D. To evaluate only instructor performance. 7. Which regulatory consideration is most critical for NCCPT certified trainers when maintaining client records? A. Ensuring data privacy in accordance with HIPAA standards. B. Keeping only paper-based records. C. Sharing client progress publicly for marketing. D. Retaining data indefinitely without consent. 8. In curriculum development, what is the main advantage of backward design for NCCPT programs? A. It begins with desired outcomes and aligns learning activities accordingly. B. It focuses only on textbook coverage. C. It prioritizes scheduling over objectives. D. It disregards assessment criteria. 9. What best defines a summative evaluation in NCCPT educational programs? A. An assessment at the end of instruction to measure overall competency. B. An informal discussion between peers. C. A feedback session during training. D. A checklist of attendance records. 10. Which instructional strategy best supports kinesthetic learners in NCCPT certification courses? A. Practical demonstrations and hands-on activities. Lengthy reading assignments. C. Passive listening during lectures. D. Watching videos without follow-up exercises. 11. When mentoring a new trainer, what is the most effective way to encourage reflective practice? A. Have them document challenges and solutions in a training journal. B. Provide generic performance feedback. C. Limit discussions to technical skill drills. D. Avoid debriefing after client sessions. 12. A certified personal trainer notices that a client's motivation is declining. Which communication method is best to address this? A. Use empathetic listening to explore underlying causes. B. Give strict verbal instructions. C. Ignore emotional factors and focus on program intensity. D. Assign penalties for missed sessions. 13. Which of the following is an essential element of NCCPT's ethical standards? A. Promoting client safety and informed consent. B. Guaranteeing specific client results. C. Offering unverified nutrition advice. D. Prioritizing business goals over health outcomes. 14. When evaluating the success of an NCCPT workshop, which method provides the most comprehensive feedback? A. Combining participant surveys, observation, and performance data. Only collecting post-event evaluations. C. Focusing on instructor feedback alone. D. Using anecdotal evidence. 15. Which curriculum evaluation technique best measures long-term learning transfer in NCCPT programs? A. Follow-up assessments conducted months after training. B. Immediate post-tests. C. Instructor satisfaction ratings. D. Attendance reports. 16. To align with adult learning principles, NCCPT educators should prioritize A. Relevance and self-directed learning opportunities. B. Instructor-led authority and control. C. Repetition without application. D. Uniform pacing for all learners. 17. Which mentoring practice best builds self-efficacy among new trainers? A. Setting achievable performance goals with progressive feedback. B. Offering only criticism to push improvement. C. Withholding support to test independence. D. Ignoring individual learning differences. 18. In a client-centered fitness program, evaluation methods should focus on A. Personalized progress toward the client's goals. B. Comparison to national athlete benchmarks. C. Trainer preference. D. Arbitrary fitness milestones. 19. What is the most effective way to teach regulatory compliance in NCCPT courses? A. Using case-based examples of ethical and legal dilemmas. B. Reading compliance laws aloud. C. Providing a single lecture without interaction. D. Assigning memorization tasks. 20. In an NCCPT course, how should instructors handle diverse learning styles? A. Incorporate visual, auditory, and kinesthetic teaching methods. B. Use one standard lecture method. C. Focus only on the fastest learners. D. Avoid adapting materials. 21. When designing client assessments, why is validity important? A. It ensures the test measures what it is intended to assess. B. It guarantees higher scores. C. It simplifies test grading. D. It eliminates the need for standardization. 22. What type of evaluation best determines whether NCCPT trainees can apply learning to practice? A. Performance-based assessments. B. Multiple-choice knowledge tests only. C. Attendance records. D. Peer surveys. 23. To ensure regulatory compliance, an NCCPT trainer must A. Maintain current CPR-AED certification. B. Offer unsupervised training sessions. C. Provide medical diagnoses. D. Skip documentation for repeat clients. 24. Which instructional method encourages critical thinking in NCCPT certification programs? A. Case study analysis. B. Fact memorization drills. C. Role repetition without discussion. D. Passive lecture sessions. 25. What is a primary function of feedback in NCCPT learning environments? A. To guide learners toward continuous improvement. To penalize poor performance. C. To measure attendance only. D. To summarize grades. 26. When mentoring a struggling trainee, what is the best approach to enhance learning? A. Provide specific, constructive feedback linked to performance goals. B. Offer vague encouragement. C. Avoid addressing weaknesses. D. Increase workload without support. 27. Which evaluation method best supports continuous improvement in NCCPT programs? A. Ongoing formative assessments and participant feedback. B. Final certification exam scores only. C. End-of-term instructor evaluations. D. Attendance tracking. 28. What key principle ensures fairness in NCCPT testing environments? A. Consistent testing conditions and unbiased grading. B. Allowing extra help for select students. C. Adjusting scores for subjective reasons. D. Ignoring test discrepancies. 29. Which skill is essential for NCCPT certified trainers to mentor effectively? A. Active listening and empathy. B. Directive control. C. Monologue instruction. D. Limiting communication. 30. In program evaluation, which data best reflects learner performance improvement? A. Pre- and post-test comparison results. B. Instructor satisfaction. C. Class attendance. D. Course duration. 31. What strategy helps NCCPT trainers promote lifelong learning in clients? A. Encourage goal setting and self-monitoring habits. B. Focus solely on short-term outcomes. C. Avoid discussing progress tracking. D. Provide static workout plans. 32. Which learning outcome demonstrates mastery in NCCPT certification training? A. Applying exercise science principles to individual client needs. B. Memorizing textbook chapters. C. Repeating terms verbatim. D. Observing others without practice. 33. To ensure ethical and regulatory adherence, NCCPT trainers must always A. Operate within their scope of practice and refer when necessary. B. Provide medical treatments. C. Guarantee client results. D. Skip documentation if clients consent verbally. 34. In NCCPT mentoring programs, what is the most effective strategy to develop critical problem-solving skills in new trainers? A. Encourage reflective analysis of real client scenarios followed by guided feedback. B. Provide standardized answers without discussion. C. Assign reading tasks without application. D. Limit trainees to observation without engagement.